Good afternoon, everyone. I'd like to welcome back and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who addresses the latest COVID headlines and answers your COVID questions every Tuesday and Thursday right here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering your viewer-submitted questions, as well as addressing the latest COVID news through today, the 18th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Biskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
And now for some updated COVID statistics. The United States still has 62.9% of the population fully vaccinated, and we are averaging about 800,000 positive cases per day. There's been a 98% increase over the last 14 days. This is rather unfortunate because there are only 24.1% of the country that has their booster shot, and we are still seeing about 700 to 800,000 new COVID cases every single day. Hospitalizations have increased by 61%. Deaths have also increased by 57%. And in Illinois, we have a death rate of 88% and hospitalization of 22%. What can you tell us about this booster situation of only 24% of the country has their booster shot versus what we're seeing with the death rate and hospitalizations?
Well, it's surprising that the numbers aren't even worse, considering that you really need the booster with this Omicron. That's unfortunate. Again, we can look at the Israelis for what they're doing, because they started like 2 months before us and everybody got vaccinated right away. They're already doing a second booster or a fourth shot in certain populations. And they've had breakthroughs even after the 4 shots, but they've had no deaths and nobody on a ventilator or with ECMO, the breathing machine. So they're considering it a big success, and their modeling is that they think that the Omicron will peak in the next week and start going down. We'll see what happens, because they're ahead of us.
Right, definitely. And now, speaking of the international community, the endemic in the UK, is the pandemic starting to play its end game out, Dr. Murphy, in the UK?
Well, yeah, they were scrambling at the beginning because they had one of the first big peaks. And so they were just giving vaccines to everybody. They didn't care what vaccine you got. It was just this whole crazy hodgepodge. And now, between all the people that got sick and all the people that got vaccines, 95% have some level of immunity. So they think that is going to protect the population and get them back to something normalish very soon. And to back that up, they have a completely centralized healthcare system, the National Health Service, like many European countries and other countries around the world. So they know when anybody goes in the hospital, they know when anybody dies. It's all in one big central database. And the death rate from COVID has just plummeted. And we know in the United States that fully vaccinated people, the death rate is only 0.024% of if you get COVID. And it's mostly in older people with underlying diseases. So that's terrible. But still, the percentage is really low. And so they're seeing really the same thing, but they got more people vaccinated and more people immune. So they're predicting that the flu season is going to really just be the COVID season. But the thing with COVID, it doesn't necessarily have to come in the winter. It just kind of comes when it wants to come. So it's encouraging in a way.
No, absolutely. Now, for our second big headline, the CDC updates their guidelines and guidance on the best masks to protect against COVID, specifically Omicron. What can you tell us about mask wearing and how we can best?
Well, Omicron is 3 to 6 times more contagious than Delta and the other variants out there, and it's taken over. It's well over 90-95% of all the cases in the United States now, mostly around the world. And the especially the cloth masks are not as effective. There was a big study in Bangladesh with 340,000 people. The surgical masks did better, the little blue ones that they wear in the hospital. They did twice as good as the cloth ones, probably because there's no real standard with the cloth one. But anyway, the N95s means 95% of particles get blocked. That is a much big step up from the other masks. And N stands for NIOSH, National Institute for Occupational Safety and Health. US, it's a US certification, and it'll say right on the mask, not N is for NIOSH. KN is the Chinese authority equivalent to NIOSH, and so they have the Chinese version 95, KN 95. Now so two weird things. One is most of the N95 masks, the US certified ones, are made in China. And 60% of the KN95s are counterfeit. They're not even legitimate. So you've got to be very careful what you buy. And there's a couple ways you can look on the internet to see what's fake and what's not fake. So a lot of the KNs are counterfeit. And one of the things is ear loops. Ear loops are not, these type of masks don't use ear loops. It's just a band, two bands, one like up at the top and one more at the bottom. There's also a Korean one, a K something or other, 94%, and there's the European ones, which are the FFP2, which are equivalent to this. So there's all sorts of masks. Another thing to do if you don't want to wear those masks because they are a little bit uncomfortable, is to wear a surgical mask and then have a cloth mask over the surgical mask. And that's about 85% protective. So it's better than what we were doing before. So that's a recommendation. Any mask is going to help, but those work the best.
Wonderful. Now for one of our, COVID questions. Couldn't it be true that the surge in the number of cases of COVID are a byproduct of so many individuals getting tested around the holidays and now fewer people are getting tested? And this has resulted in the leveling off in some places. Additionally, fewer people are congruing in masses since the holidays are over. So why is the number not rising?
Well, there's many things that cause a big surge and spike. So the holidays definitely caused people moving around. The airports were full. People were congregating from multiple states and cities and neighborhoods and whatever. And that did cause the surge. If you don't believe, part of the problem here is believing the actual case numbers. Because now a lot of people are getting tested at home and that doesn't get reported. In a few places it does get reported, but in Illinois and Chicago it doesn't get reported. Most places it's not reported. And people, it would be voluntary reporting anyway. However, hospitalizations have to report that when someone comes in. And when someone dies and COVID has something to do with it, that also has to be reported. So not only did the case numbers go up, but the hospitalizations skyrocketed. And that's why the hospitals now are full and some of them are imploding because of all these hospitalizations. So that's a very real number. And then you look at those hospital patients and patients in the ICU, which is also measured now, and they're 80 to 90% unvaccinated.
Right. No, absolutely. Now for our second COVID question.
Yeah.
This individual's neighbor's daughter is concerned about giving her 8-year-old daughter the vaccine, as there have been some studies to show that it might affect women's menstruational cycles. They have not heard this on the news, and they understand that Fox News is sharing this. What can you tell us about menstruation cycles and the vaccine?
Yeah, no, this is an issue that's been tossed around, sometimes irresponsibly, but it's been studied. So the National Institute for Health granted the University of Oregon and 4 other reputable institutions, and they studied 3,959 women. 2,400 of them had received the vaccine, and 1,500 did not have the vaccine. And then they followed them. And they did find that in the vaccinated people, that their cycle length, the time to the next menstruation period, increased by approximately 1 day. And for the few people that got 2 of the Pfizer doses in a 3-week period in between the cycle, that increase was actually 2 days. After that cycle, everything went completely back to normal. Menstruation was completely normal, but it was just a cycle length. So anyway, basically, it does happen. It's self-limited. It doesn't have any other effect. We don't even know. We don't even ask people when they have other vaccines if this same thing has happened. This is the most it's really been studied. So we don't know if you get a shingles vaccine or some other tetanus shot or something like that, or even with the flu shot, if this happens. It's never been really looked at as carefully as this almost 4,000 person study by Dr. Allison Edelman from Oregon, and it's published in the Obstetrics and Gynecology Journal, a highly reputable journal. So yes, it happens. It's a minor thing. It's only related to 1 cycle, and I think I would feel pretty safe that this is really nothing to be of significant concern.
Wonderful. That's great news. And now for our third question. The immunity of some vaccines like TDAV and shingles and others lasts for years. Yet the COVID vaccine immunity drops off after a few months. What's the difference, Dr. Murphy?
Well, there's a couple differences. They're different diseases. They respond differently to the immunology. The coronavirus is highly mutable. It doesn't look anything like what it did when it came out of the first variant. The first virus came out of Wuhan, China, and it's just a very different animal, and we don't know with time and the eventual immunity that the population gets. This may be just like flu, and you get a shot every year or 2, or whenever there's a new variant pops up. I mean, it could evolve into something like that, but no vaccines are actually 100%. And so, and coronavirus, everything, it's such a crazy virus, and it's so contagious, and it mutates so quickly. It's just a very different animal, but that's really why it's caught a lot of people by surprise. Like, how come? Why is this immunity last so little? I think the primary driver is that it just mutates around the vaccine that was developed. And so like the flu, we're going to have a new vaccine every once in a while.
Definitely.
Mm-hmm.
Now for our last question. Dr. Murphy, I have a question for you. After a lengthy discussion with my son, he asked, why is the COVID vaccine called a vaccine since some people are obviously still contracting COVID after being vaccinated and boosted? Shouldn't it be called a COVID shot? This makes a lot of sense to me since we have a flu shot available every fall and not a flu vaccine. What is the difference, Dr. Murphy?
Okay, so it's semantics here. Now, the Pfizer and Moderna and Johnson & Johnson and AstraZeneca and these other vaccines are vaccines. They make a chunk of the virus, a molecular chunk. The immune system recognizes it and responds to it, stores some data, makes some antibodies. That's a vaccine. I think the question here is, okay, why should it be a vaccine if you can still get infected? Well, nobody was saying at the beginning that this wasn't a vaccine when it prevented 95% of the infections, like with the original virus that popped up in 2019, in early 2020. They're just saying it now because, all these people are getting infected, but they're staying out of the hospital. They're not dying. And some of them are getting protected from these vaccines if they're properly boosted. We didn't even know what the best optimal regimen was, which was at least 3 shots. And now, like with the Israelis, they're saying it's 4 shots. Or maybe you should be mixing and matching, the Moderna second and this one, whatever it is the optimal way to do it. But make no doubt about it, it's a vaccine. Doctors just don't say, I'm giving you a shot. No, I mean, a shot is just, okay, an injection. It is a vaccine. You are immunologically telling your body to be prepared for this thing. So it's a little bit wordsmithing here, but it is a vaccine.
Wonderful. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Okay, see you Thursday.